Okay, we're going to go ahead and get started. We've got the meeting being recorded, and we will share that posted on our website. So let us rock and roll today. So good morning, everyone. My name is Cassandra Keller. I'm our Community Options Benefits Section Manager. So what that means is that my teams oversee all of our home and community-based services, as well as a couple of our state plan benefits, which is long-term home health, private duty nursing, and pediatric personal care. With me kind of behind the scenes, I have Victoria Rogers, who is our residential benefits specialist. Next slide, please. Quickly, just grounding us in our mission to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Next slide, please. Okay, I just want to give us a couple of housekeeping reminders before we get too far along. So we are specifically seeking feedback today on the IRSS definition rule and that language only. We do ask that you keep your comments and suggestions specific to the proposed language and not in general about the rates or billing or the rate alignment overall. This meeting today is intended to be a verbal discussion. So if you prefer not to speak or don't get the opportunity to do so, we are continuing to accept that written feedback via the survey, which is going to be put into the chat today. So please, if you do come off mute to speak today, I will call on you. Please stay within those 2 minutes since we do have a pretty short time today. Please be respectful of others, allow space for others to share their input. Please don't share any confidential details, and please no personal attack. Next slide, please. Okay, so I want to start off with kind of the impetus behind what we are doing today and what our goal was. So the goal of this rule change is to provide clarity on the two types of IRSS settings. I think there's a lot of confusion about what IRSS settings are and kind of what goes into what category. So there is two types. We have one setting where staff comes in to provide services, but they don't live there. So that's rotating staff periodically with some form of regularity to where this member resides. The other is where the primary caregiver lives with the member. This could be what is considered a host home, a family caregiver setting, but keep in mind that family caregiver is not really a setting, it's a type of person who delivers that service. So what we're really looking at is a setting in which someone lives with a member and a setting in which there is no one who permanently lives with that member. The cost to deliver these services is fundamentally different. So what we are asking for you to do today is to provide feedback on the proposed definition for staffed home to help us achieve this goal. This rate alignment is not going to be reversed. So based on feedback today, we're not making a decision of whether we should proceed with this change or not. This is moving forward. This is in an effort to appropriately align the services provided while also reducing the funding based on the $1 billion budget shortfall for this current fiscal year. So this is doing a dual purpose to appropriately reimburse those services and to also come up with some cost saving. Next slide, please. So what is changing? Specifically, we're revising how IRSS individual residential services and supports are defined in regulation. So what we are trying to create here is two types of definitions for those settings: staffed home, where the caregiver does not live with the member and provides care, and then what we're calling the host home, the primary caregiver resides with the member and provides care. Now, please note, we may have not hit the mark perfectly on the head, and based on your feedback that we've received through the survey, we are off a little bit on what you all feel is the best way to define the service. But we welcome your feedback, and we're already looking at how we can kind of tweak this language based on the feedback you provided. So know that this is our first attempt in our draft of how to define these settings, and we welcome you to help us better refine this definition. Next slide. Again, why this is changing. We recognize that we have unclear rules and we have inconsistent communication that has led to confusion between what constitutes IRSS and one rate and then that IRSS host home rate. The proposed change will ensure that we have accurate billing, appropriate reimbursement across our settings, and savings to support that program sustainability. It's also going to help us close that budget gap and sustain all developmental disability waiver services. What we really don't want to do is put at risk the ability to serve all of the DD waiver members that we have. Next slide. Okay, so our current definition is we have the individual residential services and supports definition, where that setting includes a setting owned or leased or controlled by the provider agency, a setting of a family member, their own home, a host home. And then the reason we talk about host home having 75% of the time living there is we had a lot of examples where a host home provider actually was operating multiple host homes and kind of bouncing between homes. What we really want to see is that the host home is the primary residence of that caregiver. So whether that is a host home provider, someone who is a family member providing that care, they need to be permanently residing with that member. So this is how it is currently defined. Next slide, please. So I don't want to, this is a very dense slide and I'm not going to read this to you, but what we are really trying to do here, and again, maybe we need to make some tweaks here, but we have defined IRSS staff setting as a setting where residential habilitation is being provided primarily by an employer contractor, and the residential agency has physically present, let's see, trying to paraphrase here and botching it, who are physically present in the setting, but they don't reside in the setting. So this care is provided in shifts and is managed by the provider agency. And what we're trying to make clear is that this is regular care that is provided on a consistent basis, not something where backup care or respite care is periodically provided in the setting, that it's someone is got family or a host home where they reside with the member, but every now and again, staff comes in to provide that backup care. So then we have the host home is provided to members by an individual that resides in the setting. So that is straightforward. This includes someone who is a family caregiver and someone who is that typical host home. You will notice in these rules, and we've gotten some comment of, hey, you've forgotten about family caregiver, like you left out these other types of settings. That is intentional. We are making it clear that the host home is a setting in which the caregiver, the primary caregiver, resides with their member. They can either be someone who is related or not related. That is just what the setting is. And so family caregiver is not called out because that is just a type of person who renders the care. Okay, next slide, please. So just want to highlight a couple of the key differences between the two different types of settings. So IRSS staffed home, you have someone where the caregiver does not reside in the setting. So it could be that the member owns their own home and staff comes in periodically to render care. Or it could be a setting in which the provider agency owns the home and multiple members live there and staff comes in and provides care on a regular basis. Host home is the individual providing the service resides in the setting. So they live with them on a full-time basis. For the IRSS staff setting, care is provided in shifts and managed and scheduled by the backup or by the provider agency. This doesn't include backup care, as I mentioned. For host home, care is provided by the primary caregiver that lives with the member. So for the staffed home, they would receive that staffed IRSS rate. And then for the host home, they would receive that IRSS host home rate. Next slide, please. Okay, next slide. We're just going to talk a little bit about the feedback that we have given. So we got some pretty diverse feedback. We have heard primarily from provider agencies. We've heard from a lot of family members. So this is great. We have gotten a pretty diverse group. And as of this morning, this was updated, we've gotten 69 responses, which for a survey is pretty darn good for us. So we have been combing through that feedback, trying to understand from you all ways that we can tweak the language. And so we are kind of in the process of digesting and seeing how we can incorporate your suggestion. Next slide. So a little more specifically, what have we heard? Some of these main themes. So we've heard that we need to clarify which settings apply to IRSS staffed homes versus IRSS host homes, including care provided by unrelated individuals. I think we heard using the word unrelated is a little confusing. And so really, we don't even need that part of the language. We also heard that establishing a clear distinction between having access to 24/7 care and receiving continuous rotating 24/7 care. So there's a pretty big distinction between someone who just has staff available on call and then staff who is actually in a house providing that hands-on care or prompting and cueing. Safety concerns. This change does not alter existing expectations or practices for IRSS settings and their providers. And we've also heard some suggestions that a middle tier rate structure is ideal. Unfortunately, this is something
at the bottom.
This is unfortunately something that we cannot implement within the current fiscal year due to our budgetary constraints. So we've heard you that you would very much like to see the structure a little bit differently, perhaps 3 different rates, but at this point in time, that is not something that we are able to do. Next slide. Okay, here, look at that. At 11 minutes in, and we have left ample opportunity for folks to provide feedback. If you could go to the next slide for me, Victoria, please. So I just want to reiterate again, we do not have an opportunity for written feedback today within this meeting. So as you notice, there is not a chat and there is not a Q&A function. We are using the IRSS survey so that we can more appropriately and in one space have all of our different feedback in one consolidated area. So I would encourage you, if you do not feel the desire to hop on the call and ask your question or make your comment live, that you would do that in the feedback form. And then next steps, I just want to make clear what our next steps are here. Maybe there is a slide for that. After public comment, what I'd like you to know, what our plan is that we have one more stakeholder meeting after this. So our plan is to take all of the feedback that you have provided up through now, today, and then through Friday, using that form and your comments today. We are going to revise our definition. We will do so based on your feedback. We will then publish that feedback through our newsletter and provide that information up front. So you can say, hey, here's what the revision looks like. Here is, what we've done with that rule. And then we will have a meeting to talk about what those changes look like and then refine it again after that. So that is the plan. Take your feedback, make our changes, and then share that with you again. So I think without further ado, unless I hear anything from Victoria, I think I am going to go ahead and open up the floor for public comment.
Yeah, Cassie, the first one with their hand raised is going to be Pat. Just for folks to know, we're going to kind of go in order of how your hand is raised, and just be mindful of the 2 minutes for public feedback. Thank you. Go ahead, Pat.
Hi, I'm Pat Chamberlain, mom and family caregiver currently, and I have extreme concerns about this change. It's completely false information that's been given to many, many people. There are not just 2, there are 3. And my question, I'm going to try to stick to your...
Pat, we are having a little bit of trouble. You're breaking up, and
My question is this. Are you suggesting that we're supposed to have an option of a staffed home at the current IRSS rates? Because that would not even pay anywhere near minimum wage for 24 hours.
Pat, you broke up a little bit, but if the question is at the of the 2 reimbursement rates, the higher one would be the rate that we are utilizing for that staffed home for rotating staff to come in. And we currently have staffed homes. They utilize that current rate, and so it is something that has happened, has been occurring, and will continue to occur under that existing rate.
That's not true.
Okay. All right. Thank you, Pat. Victoria, who do we have next?
We have Ann Patton.
Hi, thanks so much. Cassie, is it possible to go back to slide 9?
Of course.
I had a question on that and I didn't take a picture of it. It was about the host home.
Is that the slide that you're looking for, Ann?
It was the one prior to that.
Prior to that, let me pull that.
Yeah, so down at B,
Uh-huh.
let's see. Homes or apartments must be the primary setting of the provider, which means that the unrelated person occupies the setting 75% of the time. So how does that include somebody that it's their own home?
That's a good question. So, are you thinking in that scenario it would be kind of like a reversed host home in that the member owns the home, but then
Potentially.
Okay.
Yeah.
Yeah, I think that's a great call out, and that would fall under that host home category. And so I think excellent point that we should probably, or we need
Can you
to
turn the
adjust
chat
that
on?
language.
Yeah, it
To
could be, a member choose,
Can you turn the chat on?
they want their own apartment. Sorry, Cassie, go ahead.
Oh, no, that's okay. We had a couple folks off mute. We're not going to disable the chat at this point in time. We are keeping that disabled, but you're absolutely right,
Can
Ann. I
you
think
turn it on?
you have made a very valid point that if we're calling that a host home in which there's still someone who lives in that residence, but the member owns it, that kind of is excluding there. So great point. All
Okay,
right.
next up, we have Nicole Villas. Nicole, if you want to go ahead and take yourself off mute.
Yeah, can you go back to that slide again, please?
Oh, sure, sorry.
Thank you. I have a few comments on this. First of all, you keep saying that you're not excluding family caregivers, and yet in that section B under A, it still says that the unrelated person occupies the setting 75% of the time, which excludes all family caregivers.
You're correct in that point, and so we do need to make it more clear that and the goal of that language there again was to make sure that a host home provider who's unrelated.
Yes, okay, I understand.
Yep.
You
No,
need
I
to
hear
take that
you.
out.
So we
I'm
do
going
need
to
to
use
fix that.
the rest of my 2 minutes here. That needs to be removed 100%. And please don't send out any more communications from HICBUF with that unrelated term in there because it's insulting. And you're making us run in circles trying to figure out what you mean and what's a mistake by you guys because you've tried to correct so many mistakes along the line. I think my comment on this definition of a staffed home versus a host home, this violates the Olmstead final settings. This does not leave the choice of where they want to live and whom they want to live with up to the disabled individual without looking at a cut to their services. So this is incredibly discriminatory. The individual is not allowed to live with the person that they choose to unless they want their services cut by 10%. And that's crazy and illegal. The person should be allowed to live in the most integrated setting of their choice. And for people with higher needs, they can't be with host home providers and specifically now with unrelated host home providers. So they are necessarily forced down to that lower rule, which is discriminatory to them. Third, that you said that there are staffed homes that exist right now and that are functioning, and that is correct. However, they are not functioning with this only direct care service under the DD waiver. They're functioning using funds like Community Connector, using funds like DayHab, which not all of our members can access. So you're relying on supporting funds to make this staffed home from other programs within the DD waiver. And that itself is discriminatory because the DD waiver is supposed to provide access to 24/7 care for the residential component of these members. And if you are creating a separate group based on funding, additional funding coming from Community Connector, coming from DayHab, et cetera, you're automatically saying that the people who have higher needs and who can't access those things don't deserve the higher residential funding rate. So there's so much discrimination in this. And the fact that you're not allowing public comment on the meat of this, which is the cut to 10% cut to existing direct care, is shameful.
Thanks, Nicole. I appreciate all of your comments and feedback. Victoria, who do we got next?
Dana Lang. Dana, if you can come off mute.
Hi, thanks everyone. I am a parent PASA, and my daughter is a level 7. So I'm curious, how is this going to work? Because typically staffed home isn't realistic for that level of care. All of her needs need to be met by someone else. And then to Pat's point, some of these rates, you need to take a look at them because a staffed home 24/7 without any other services like community connector, trips, personal, whatever. If it's just the daily rate, some of these rates, you do need to take a look because I thought it's illegal in the state of Colorado to pay somebody less than minimum wage. And a lot of these kiddos may need 20 people to be awake during sleep hours. So that in that regard, I'm curious how you all are going to address the kind of legality of minimum wage not being met with some of these rates. And then my question on the level 7, that to staff a level 7 is probably next to impossible. A lot of these parents on here have some level 7s. I struggle with it all the time. So what if it's also, so one of my questions is, what if it's staffed 50% of the time of a family caregiver, someone related to the individual? What if it's staffed 20% of the time? Like how are you all going to regulate the staffing, I guess?
Sure. So I'm going to try and hold making any commentary and responses to a lot of the comments coming in because I want to make sure that you all have opportunities to make your feedback. But for the level 7, I would say that's a negotiated rate. So that is based on the staffing needs and the needs of that member specifically. So it's less of a predetermined rate. And so it really is that individualized rate that is determined by the department and the needs of the member. So that is not going to change. That is going to stay how it is. And then I would say for per diems, that functions pretty differently than the way other rates are. But the staffed home model is paying people appropriately. But we're obviously going to continue to monitor compliance, and we capture that data through the the direct care worker wage attestation, the wage pass through. So we do capture that information. All right, Victoria, back to you.
Let's go ahead with Megan Bowser. Megan, please go ahead and unmute yourself.
Hi, thank you. I would echo the many comments that have been said already about the rates for the service are already exceedingly low, especially when we compare to the options under, for example, the SLS waiver, especially with community first choice. There's just a huge disparity between these per diem rates and what people can get under community first choice under programs like CDOS or IHSS. And so this is already a kind of vulnerable population that is already receiving a very, very low rate to start with. And so it's hard to see that going down more, in whether it's intentional or just not, that going down lower when it's already a disparity between other programs that exist. I also wanted to say that people don't fit in nice, pretty boxes. So I appreciate the intent of having two very clear, distinct boxes, but people are people and they don't fit in boxes well. And so in many, many situations, it really is a combo of these. We can't get a fully staffed home. And so we have to do this hybrid option. And this is removing any sort of flexibility and any provider sort of judgment in order to figure out where in that kind of hybrid gray area world these cases fall. And so the rules need to address what real people and what it exists like in the real world, not just what we wish how nice and clean this separation could be.
Thanks, Megan. Value your feedback. I hope that you have some suggestions and ways we can make that better. I always appreciate your insights. So hopefully you filled out the feedback survey. Victoria, who do we got next?
Robin Vick. Robin, if you can unmute yourself, you have 2 minutes.
Thank you. So basically my comments mirror a lot of
Robin, I think you're on mute. There you go.
Okay, can you hear me?
Yeah, I can hear you.
Thank you. I am the parent. I'm getting a lot of feedback. I'm the parent and family caregiver of a daughter who has significant needs, requires 24/7 line of sight care. And I think there are a lot of us on this call. And what we are seeing is this really limits the families and the people with disabilities. It violates their right to choose who they want to live with, because their care cannot be provided with the funding that you are suggesting, living in home with trusted family caregivers. So you're going to force these people into staffed homes with unqualified caregivers that are being paid very little because of these rate models. And many people who support and live with people with higher needs must have in-home staff right now to make this work. We cannot be the sole provider. So we are running a hybrid staffed home out of our own house just to make this work. And even with that, the Medicaid rates are so low that many family caregivers are working for free or below minimum wage. We're struggling, and we're really just trying to make whatever you give us, we're trying to make it work for our families, but we're struggling with the current rates. And
We lost you at the end there, but thank you for your feedback. I do want to kind of put out there for folks who are going to come off mute in a moment and make their comments known. Is there if we have those situations that are hybrid, where that is perhaps half of the care provided by a host home provider or a family, someone who resides in the setting, and then half is done by staff who comes in, is there a to make sure that we capture and appropriately reimburse, does it need to be that they provide family is 60% of the care? How do we deal with that category? So any suggestions there would be welcomed if anyone wants to comment on that. But Victoria, I will hand it back to you.
Chad, I believe you had your hand up next. If you want to go ahead and unmute yourself, just be mindful of the 2 minutes, please.
Yeah, hi. So I was hearing a couple of things when we were talking about the IRSS staffed home rate and then the IRSS host home rate, as in singular for those. And so I just had a question, and depending on the response, I may have a follow-up comment or recommendation. But are we saying that the tier levels are going away and it's just going to be a single rate for these?
Great question. And no. So to be clear, there will be 6, and 6 isn't even right because we have Denver and non-Denver. But there is the support levels for the IRSS host home rate, and then there are the same support levels for the staff. So it would be the levels 1 through 6 each, and then we still would have the distinction of the Denver and non-Denver rates.
Okay, thank you. No follow-up.
Great, thank you.
Thank you, Chad. Next up, we have Kathy. Kathy, if you want to go ahead and unmute yourself.
Hello, my name is Kathy. I have a child or young adult who is a high level 6, borderline level 7, living at home. I just want to say, first of all, that the DD waiver is a comprehensive waiver. So a lot of us that have high needs kids, level 6, level 7, maybe some level 5s, need a comprehensive waiver. That's what this was designed for, access to 24/7 care. Our children cannot, and I say children, but they're young adults or adults, cannot be left alone ever, ever. I can't run to the store. I can't work out. I can't do any of that. He is with someone every moment of the day. The Medicaid Provider Rate Review Advisory Committee has consistently recommended aligning rates with rate increases, not decreasing rates. HCPF is ignoring those recommendations and moving away from the rate parity. If you look at that Medicaid Provider Rate Review Advisory Committee, their meeting notes, they tell you that in comparing them to other states, level 6s and level 7s and some level 5s, you can't even compare because there's nothing out there. If you look at a level 5, they're 80% maybe of the rates of other states. We are behind. We are behind funding with high level care kids. If adults on the DD waiver with high support needs did not have the family caregiver option, they would end up in an institutional setting, the most restrictive setting, which bills the state a real cost of up to $400,000 a year per resident. And so here we are, we're talking about almost just a little bit over a quarter of that. And you guys want to balance the budget on the backs of some of the most vulnerable people in this state. Shame on our governor, shame on HCPF for wanting to balance the budget on people who need the most help.
All right, thank you, Kathy. I will hand it back over to you, Victoria.
Okay, looks like we have Fritz Peterson. Fritz, if you want to go ahead and take yourself off mute.
Okay, can you hear me okay?
We can, thank you.
I just want to reiterate what she just said. I have a level 7 child. I agree with everything Nicole said. I'm starting to wonder if this is legal. Obviously, you guys think it is. My son also needs 24-hour care. I only have a nurse. I've lost most of my help. I don't know how some days I'm going to be able to run my errands, go to my physical therapy appointments, get groceries, work out. My son needs to be line of sight. He sleeps in our room, but yet if I want to hire a nurse to help me, I have to pay $40 an hour because that is currently what she gets paid. At these current rates, I can't do that. I cannot work outside of the home because there's no way. And I just think it's very, very unfair that misappropriated funds, whether they were by HCPF or the governor, that our kids, adults, are suffering because a host home, even if he would go to a host home, we still have to manage his care. I am not a host home. I am a parent who watches my child 24 hours a day.
Thank you, Fritz. I appreciate all of the feedback we're getting, all of the comments. I mean, it's incredible to hear the type of care and support that you provide your children or as a provider agency. So I appreciate and we are happy to hear all of these comments that you provided. So thank you. I will hand it back over to you, Victoria. We still got quite a few hands in the queue, so making sure we have time for everyone.
We do. Susan Root, you're next. If you want to go ahead and lower your hand and unmute yourself.
Susan, you're still on mute if you were trying to talk to us. All right, we'll keep Susan in the queue.
I'm sorry, I'm here.
There we go. All right, Susan,
Thanks,
go ahead.
Yeah, I am also a family parent caregiver of a level 7 child, young adult. Line of sight. I'm very concerned about these rules and the lack of input from the participating people that we're not allowed to comment, and basically this is going to be a done deal. Um, I'm not a host home. I have my daughter exclusively in my home that is also 24/7 line of sight, high acuity. Um, it would be challenging for any host home or residential setting to care for her. She's super high acuity, and I feel like reducing rates and making it harder for us is going to put her in risk of being institutionalized. And that is certainly not her preference. And I feel like it's a big violation of her rights and my rights. Um, we are not host homes, we are family providers. And that was what the DD waiver appeal was when we went onto waivers, was because of her high level of acuity and her 24-hour care needs. And I think that the governor and HCPF are making very bad decisions without actual reality being taken into account. And I feel like this needs to be discussed more than in 2 short meetings with no input. The survey, sure, but is that really going to be
No.
accounted for? Are you really going to listen to what people are saying about this? Or is it just a way to appease us that we
So
have something to say?
thanks, Susan. You're at your time, and I want to reiterate today a couple of points. Negotiated rates of level 7, that is not changing. Those negotiated rates will stay as they are, and that they will the reimbursement rate will be developed based on the individual needs of that member. The other thing is that we wanted to come into today very clear that where and how we can take feedback. So, we wanted to be upfront that your comments today, your stories today, while important and moving, it is not going to change the outcome of this rate alignment. What we can accept feedback and what we want to hear from you on, and what we have room to make changes on, is this definition of what staffed homes are. So we wanted to be very transparent about what we have wiggle room with and what we don't. And so I know it feels not great that this change is non-negotiable, but we wanted to be clear and upfront about what we can change today and what we can't. So I don't want to take any more time. We still have like 10 or so hands raised. So let me hand it back to Victoria for the next person.
Yeah, Teresa Wright, you're up next. If you want to go ahead and unmute yourself.
Hi, good morning. I am a family caregiver. I have twins that are level 5, 24-hour care, as many of the other parents have said. I am a host, again, a family caregiver, not a host home provider. I'm a nurse by trade. I could go and I cannot work outside the home with my children the way that they are. It's really frustrating to hear you say that this is non-negotiable, but if family caregivers, if we have to put children into staffed homes, which I believe that you think that there's a bunch of staff homes out there that are available. They are not. There are not staffed homes that can care for our individuals the way that they need to and deserve to be treated and cared for. But if we had to put them into staff homes because we can no longer sustain ourselves and we have to work outside the home, have you considered that in the long run, that's going to be exorbitantly more expensive because you're going to have to pay all of those staff minimum wage, which we don't get. And so it might solve the problem for now. You might cut your budget for now, but in the long run, you're going to drive the costs up incredibly more than they are now. And my other question is, why in the heck is there a difference between Denver and non-Denver rates? We're all doing the same work. Thank you.
Really quickly, I'll just address why there is a difference in there is that Denver has a higher minimum wage than other areas, not necessarily those surrounding counties in the metro area, but They do have a higher minimum wage, and so we make sure that the reimbursement rate for services, for all of our services, can accommodate that higher minimum wage in Denver. All right, Victoria, back to you.
Looks like we have Neil next. Neil, if you want to go ahead and unmute
Thank
yourself.
you so much. Yeah, I appreciate it. I want to be quick. First of all, I want to say thank you because you clearly moved quickly through the first part of this in order to make more time, obviously, than 10 minutes for public comment. So I do appreciate that basic common courtesy in light of the fact that chat's been disabled, which is extremely disappointing. I just want to quickly chime in and say, as far as I understand, HCBS services were intended to be both least restrictive and less expensive ways of caring for our most vulnerable citizens. So make no mistake that we all understand that this rate alignment is a rate reduction, especially for family caregivers, a group that does not have a powerful lobby. And we all know this, and we are all, feeling extremely vulnerable as it is. So, and anytime these little sort of cuts come in, we all feel it, and we know what's going on. So I'm just making it clear that we all think it's disgusting. So with that, I'm going to mute, and thank you for the time.
Thank you. Victoria, who do we have next?
Sorry, struggling to unmute myself. We have Eric Smallwood next. Eric, go ahead and unmute yourself. You got 2 minutes.
All right, thank you. I appreciate it. One thing I want to clarify, and then I have a couple of comments, but I want to clarify on the this level 7. So you say that it's not going away, negotiated rates aren't going to change. I want to make sure there's some verbiage in there too about the reapplying process, that there's not going to be some backdoor to changing how that works to kind of do away with level 7 at that end. To say, oh, well, it's not going away, but we're going to make it so people, when they reapply, don't qualify for that. Is there a way we can get verbiage in there for that?
We can certainly look at that. I don't think there's anything in there now that talks about it, but we can certainly explore that. But very clear, there is no intention of doing anything. Not that you will trust my word today, as you're saying it could change, but there is no intention of revising that level 7 process. But I keep on to your two. You had your 2 minutes, and it sounded like you had some more comments, Eric. Maybe not. I thought Eric had more to say.
Oh, I'm sorry. I thought I somehow hit mute. I apologize. Sorry about that.
Yeah, continue.
So I appreciate that. Yeah, we have to have some information here about that because, like you said, in the past, anytime the government's done something, they say, "Hey, nothing's going to change," then they change verbiage or something, so it does change. That's why I brought that up. But my other comments are that the $1 billion shortfall isn't the problem of the people receiving services or family caregivers. As one who has a daughter who's a 7, who's line of sight and everything like that too, it's not that's not where that shortfall came from. And I really think the government needs to understand that he's coming after the wrong people to make up that shortfall. But the other two things to bring up is you talk about care and things like that. Finding qualified respite care and willing to help is a problem. So even at the rates that we have right now, when I go to get somebody to help with respite, as an example, a few years back, I wanted to go to a concert. I said, hey, hired somebody, offered them $30 an hour. Great. They canceled last minute because somebody offered them $50 an hour. So the people that are out there that are willing to work, it's hard to find, and they're always looking for something better. So it's very hard for family caregivers from that standpoint. And then the last thing with family caregivers,
Eric,
if we're pushing people out.
Eric, you hit your 2 minutes, and I'm really sorry, but we have 15 minutes left, and there's a lot of folks with their hands raised.
All right, next we'll go to Tamara. Tamara, if you want to go ahead and unmute yourself, you have 2 minutes.
Hi, thank you. I am with a residential service agency who has many individuals. I think for a residential service agency, we definitely, I know you guys initially said that there is no in between of those two, the two names, either the host home and or the other option, the staffed home. There needs to be a hybrid of the two, because as many people said here, people don't fit into neat little boxes. You're gonna create an issue down the line of people choosing the rate, the higher rate, if they're in this hybrid situation. So there needs to be that third option. Also, I think that renaming either staff home or host home, these are names and terms that have been in community for years and years, and they have certain associations that they need different names for better clarification of how you want to align those services. That will definitely clear things up for families, because a host home is what is in community now may look very different, but by recycling these names, you're creating more confusion for families that are already frustrated and confused. So
Tim, those are excellent suggestions, and I'm sorry to cut you off. You are absolutely spot on with some of those. We hear you about and hear all of you, the call for a third tier. We can, kind of look at what that would take down the line. But we hear you on the naming conventions. I hope you have submitted a comment in the survey. Suggestions on those names would be super appreciated, and how we can better put folks into those two buckets. I know it's not super clean, but how can we fit those folks into those buckets? So I appreciate that comment. Victoria, who do we have next?
We have Julie. Julie, if you want to go ahead and unmute yourself.
Thank you, Julie Riskin with the Colorado Cross Disability Coalition, and people have made really good points. I want to talk about the process. When this came out, we were promised by your leadership a robust stakeholder process. This is not that. A survey that has one question, and even when you said today, like you can do written feedback through the survey isn't designed for really written feedback. It's a yes or no question and then a couple lines. So I just want to say I'm very concerned about this process. I don't think you're going to get what you're looking for, which is a reasonable rate process and a way to address some real budget issues, because you also have to have discussion about how did we get here and the lack of actual options. The people who do the staffed homes, it's when they have a host home with 3 people crammed in. That's how they're able to do that. Doing it for one person, a lot of the people here, I think, have people that can't live with others. The math doesn't work. So I think some of these things, like both, are true, but without a discussion, you can't get to that. So I just wanted to say this process deeply concerns CCDC.
All right, thanks, Julie. I appreciate those comments. Victoria, all right, we still have like 5 people and a couple of slides to talk about next steps, so get to it.
Yep, we're going to go with Charlotte. Charlotte, you are next. If you want to go ahead and lower your hand, unmute yourself.
Good morning. I too am with a residential service agency, and if you can go back to the slide with the definition, concerned about the part that it has to be, the staff setting has to be agency setting. It has to be rented, leased, owned by the agency. We have several people who are in IRSS. They are on HUD Section 8 housing. They rent their own places. Even if they're not on HUD, they rent their own places. They choose their own places. They have a staff schedule that goes in and supports them. So that's my concern about this definition, is that it says absolutely owned or leased by the provider agency, or at least that's what I interpret it to be.
I want to make clear, if that is the interpretation, we will absolutely take a look at that and make it clear, because that is not what the intention is. A staff setting can be anything that is owned by a provider agency, owned by a family member, owned by the member, owned, rented. But it is absolutely not a setting that needs to be owned and or leased, or not owned or leased by a provider agency. So we can make sure that is explicitly clear here.
All right, next up we have Cindy. Cindy, if you want to go ahead and unmute yourself.
Hi, I just, and I'm sorry, I got kicked out for a few minutes, so if I repeat what somebody else said, I apologize. I have a question about the how it would work if some of our kids with higher needs or young adults with higher needs were in these staffed homes. My son has high needs. I do thankfully have nursing for the moment. I manage that. I manage if I need to go to the doctor and I don't have nursing and I need to bring somebody in and pay them. People call in sick. My nurse called in sick this morning, so I'm listening to this meeting while taking care of my son. And then I have a work meeting for my part-time job right after this. So what happens when people call in sick? I mean, when our kids need line of sight care 24 hours a day, I can't walk to my mailbox because my son could have a seizure and stop breathing. So I just don't understand how that's even an option for some of our kids with higher needs. If someone calls in sick and someone leaves and no one's living there and on call 24 hours a day like we are, I just don't see that that's an option. So I don't know that we would fit in the two boxes of definition.
That's a great.
I have one more thing. Sorry, I forgot. Can we make those charts easier to understand, please? I've been trying to explain those to other parents. So the charts with the pay rates, and it's so confusing. So if we, just a little bit of feedback on that.
Do you mean the rate sheet that talks about what rates are?
Yes.
Okay. Okay. The great feedback. And I would say, there are lots of different types that we would expect to see in those staffed homes. One where there is more frequent staff versus staff that is in there less often. But it would absolutely be the requirement of that provider agency to have staff and backup staff that can fill in if someone is out sick. So that would be the expectation of that provider agency. Back to you, Victoria.
Yeah, I think we have probably about time for 2 more folks to provide feedback, and then we'll probably move on from there. So Chelsea, if you want to go ahead and unmute yourself, you are up next.
Yeah, hi, I just have a really quick question. I'm just curious, the percentage of members on the DD waiver, how many of them currently are in a host home or a family caregiver home? It just feels like there are a lot, obviously in this meeting, they're represented by family, but it would be interesting to know the numbers of how many this is actually impacting when you're putting them into these 2 boxes. But it feels like there's a higher percentage in the family caregivers, and then that's not really being represented here.
Yeah, that's an excellent question. We've got a lot, some limitations on because of the way the billing has occurred with those rates, but we have approximately around 4,000 individuals who reside in host homes. So there's a good chunk of folks who live in those host home settings. So we don't necessarily have the breakout of those who are in family caregiver settings, but we do know who is in host homes, and there's quite a few folks living in those settings. Victoria, who do we got?
Dawn, you are up next. If you want to go ahead and unmute yourself.
Okay, can you hear me, please?
We can. Thank you, Dawn.
Okay, so first I have my one question is there have been 3 different definitions of this new staffed home. You had one in your fact sheet that said provider agency staff rotates 24/7 to support members. In your IRSS rate alignment meeting agenda, you then said continuous in-person rotating shifts, no remote supports, and then you had a different definition in your survey. So going back to Julie Riskin's point, I am very concerned with this lack of community information and input when you yourselves have 3 different definitions and only the survey is on one of those 3. So that is concerning. I am very concerned that what you are defining as staffed home is actually a mini group home. And yet with none of the oversight that is built into a group home, you don't have a governing board, you don't have
a 24/7 oversight administrator, which would address the concerns that people are talking about here. Meaning somebody calls out sick, there's 3 people in this home, who the hell is telling you that there's nobody that showed up? So as somebody who has a level 6 24/7 line of sight within reach person, our child could never go to a host home or the staffed home because that would put his life in jeopardy. So to say that this is okay is ridiculous. And, you know, you want to say that it's based on operational costs and all this stuff. And as others have said, we are doing all of these services unpaid and without getting any of the benefits of being an employee. We don't have retirement plans. We're paying our own sick, our own vacation, funding our own retirement with no matching, funding our own medical, dental, vision, and all this other stuff from this rate that you have just now cut by $10,000. And oh, by the way, health insurance rates are supposed to go up 30% next year. So no, this is not appropriate. These are the most severe individuals in our state. It's not okay.
Thanks, Dawn. Appreciate your comments. We still have a few hand raised. I want to try and get through at least a couple more. We will ensure that we have that the definition within the survey is the specific rule language, the proposed regulatory changes. The other items, we'll make sure we align all of our documentation, but those were kind of summaries of what those changes are, but we'll make sure that it is very clear what that definition looks like. But Victoria, who do we have next?
We have Terry. Terry, if you want to go ahead and unmute. Terry, are you able to unmute, or did you no longer have your hand raised?
Am I unmuted now?
Oh, I can hear you.
Okay, thank you. Just real quick, I'm hearing a lot of parents talk about very high needs kids, and so with the definitions going forward that you are talking about, it sounds like a lot of the people I'm hearing about are not at a proper SIS level. Would you be willing to take a look at these parents who are doing 24/7 awake care, sleeping with their kids, all of this kind of stuff? Would you be willing to approve more SIS 7s at a higher negotiated rate? Because that would take care of a lot of the problems that people are talking about. Call them a host home or whatever new name, but then give them a SIS 7 so that they can actually negotiate a rate that's appropriate for them. Is that something that you're willing to look at from a different perspective like that?
Yeah, thanks, Terry. That's an excellent suggestion, and absolutely, a member is always able to do a request for a reassessment on that SIS level. I certainly can't guarantee that we would definitely move folks and can move them into a level 7, but we can absolutely do those reassessments to evaluate if the level is appropriate to meet the needs of that individual. But I can't sit here today and say absolutely we will move 20% of those folks to that higher rate. That would be inappropriate. All right, we have 2 minutes left. We have a couple of next steps I just want to reiterate, but we have one time for one more comment.
Nikita, you are next. If you want to go ahead and unmute.
Thank you. Hello, everyone, and good morning. Thank you for your time. I am going to use this 2 minutes to just let the people that are here feeling underrepresented and underserviced by these programs and waivers know that there are some resources available to add strength and reach to your voices. The first one is the Colorado Care Workers Unite, or CCWU. They have a website. It is a union-based care worker coalition that's helping to advocate for fair wages and things that it sounds like a lot of this is falling back to being underserved, underpaid, and underrepresented in our state legislature for family caregivers. And the second one that I would like to let you folks know about is the SEIU. That is a Service Employee International Union that's available, again, helping to fight and advocate for care workers and what we service industry, but these family caregivers that I think it sounds especially like are being underserved and under represented in these types of scenarios, especially if there's 200 of you in this meeting feeling like you're not being heard or that these changes are going to be impacting you negatively. So that's my 2 cents for today.
All right, thank you. Thank you everybody for your feedback today. I just want to talk about next steps really quick. I know I already mentioned, but if you go to the next slide, Victoria, where we've got the info, we are going to, again, take your feedback, make changes to that definition based on what you have said today, and then we will be holding our next stakeholder meeting on November 20th from 11 to 12. So we will focus on recapping all of that feedback that we received, sharing the survey results, and then presenting to you the revised definition. But we will make sure that gets sent out ahead of time so you have a chance to digest and come prepared with comments. Thank you everybody for participation today. We really appreciate you joining us. If you have questions specifically about this definition that is not really feedback, but you had a question, please feel free to use the HCBS questions inbox and we can field your questions there and get back to you if you had specific questions on things today. So again, thank you very much for your participation.